This PowerPoint slide is on Alzheimer's dementia by Tammy Gibson. Alzheimer's disease, we're going to talk about the risk factors, the pathophysiology of the disease process, the signs and symptoms, and the assessment tools. The risk factors for Alzheimer's disease are that the patients are over the age of 60. It rarely occurs before 60, and most of the time is after 65. African Americans have a 14 to 100% higher rate than Caucasians. Hypertension, hyperlipidemia, and obesity are also risk factors. Hypothyroidism. The population that has the less mentally challenging jobs has been researched to have more incidence of Alzheimer's. If there is a family history of Parkinson's, low levels of the neurotransmitters serotonin, norepinephrine, and acetylcholine are also noted in patients with Alzheimer's disease. Alzheimer's disease is a degenerative brain disorder. It is the most common form of dementia and is progressive. It's an irreversible and incurable progressive neurological disease caused by the degeneration and eventual death of a large number of neurons in several areas of the brain. It is accompanied by diminished brain size. Early signs and symptoms. The first symptoms of early-stage Alzheimer's disease usually include forgetfulness, short-term memory loss, temporary episodes of spatial disorientation, groping for words, minor problems with arithmetic, and small errors in judgment, often accompanied by some anxiety, agitation, mild depression, and withdrawal. The patient is unsure of what is going on in the early stages of dementia. A lot of times their family or friends will notice it and they'll make excuses for it or just say no, they're tired. But with testing, and it should be done and encouraged to find out if they have Alzheimer's disease. There are considered to be 7 stages. The first stage, they may carry the gene mutation. That does not mean they will get Alzheimer's, and they may have no symptoms. In the second stage, you may notice episodes of forgetfulness and ability to function. In the third stage, and this is called the early stage because the first 2 stages usually go undetected, the cognitive skills are diminishing. The most common early symptoms of Alzheimer's is difficulty remembering newly learned information, because Alzheimer's changes typically begin in a part of the brain that affects learning. The mild stage, number 4, is when assistance is required with normal daily tasks. They are getting moody and anxious. In the 5th stage, it is the moderate stage. It's where you need assistance with activities of daily living. They have difficulty verbalizing what they want or need. They have impaired reasoning and no short-term attention span. Number 6 is the moderately severe. This one, the patient requires full assist and may be withdrawn. They cannot do anything without assistance because the ability for their brain to tell their body to do anything is not there. Number 7 is severe, and this is when the muscle control has gone. Many patients become bedridden, basic processes shut down, and then the patient expires. The ability to even just breathe is not there. They can't perform voluntary movements. They don't recognize anybody. The assessment tools that we use to see if they have Alzheimer's is to check their medications to make sure that the confusion is not being caused by anything that they are taking. Disease processes. We want to make sure that they aren't having difficulties with COPD or CHF that is causing confusion. Lifestyle. We want to make sure that they are not using illegal drugs, have a severe drinking problem that would cause any kind of confusion. We also want to use the CT and MRI to get pictures of the brain to see if there are any changes. Specialty diagnosis. If the screening tests are suspicious for cognitive impairment, the primary care physician may refer the older adult to a psychologist or a psychiatrist for further testing. Although many primary care physicians are comfortable making the diagnosis of dementia without a referral. Alzheimer's disease is somewhat of a mystery. We are not sure why it happens, and we continue to do research for things to help with the symptoms, yet there is no cure. Early detection of Alzheimer's disease is very important for developing strategies to manage the symptoms and help the patients and their families so that they can plan long-term for financial and any kind of help they would need, because eventually they become a total care patient and eventually they will pass away. Thank you. That's my presentation.